Let us be candid. Almost every dentist immediately recognizes the group of patients we are referring to. These are not necessarily patients with the most severe diagnoses, the most complex prosthodontic requirements, or the most demanding surgical procedures. In some cases, the treatment itself may be entirely routine, yet every interaction with the patient becomes emotionally exhausting. Telephone conversations take far too long, explanations never seem sufficient, an agreed treatment plan is repeatedly questioned, and even a minor inconvenience may escalate into conflict. This phenomenon is addressed in Emotional Intelligence in Dentistry, edited by Mary Collins, which refers to the familiar business analogy that 10% of clients generate 90% of the problems encountered in professional practice. It is important to emphasize that this should not be interpreted as a literal statistical statement about dental patients. Rather, it illustrates something that many clinicians intuitively recognize from everyday practice. A relatively small number of interpersonal relationships can consume a disproportionately large amount of our time and emotional energy. The problem is that we may very quickly begin to label such an individual as a difficult patient, rather than attempting to understand what may actually lie behind that behavior. Fear of pain, a perceived loss of control, negative previous dental experiences, financial concerns, embarrassment about oral health status, or simply the feeling that nobody is listening may outwardly manifest as anger, mistrust, stubbornness, or persistent questioning. The book emphasizes that empathy does not mean agreeing with the patient, nor does it imply abandoning one's professional judgment. Rather, it is the ability to understand the patient's perspective, acknowledge their emotions, and at the same time maintain clear professional boundaries. This is precisely where it becomes apparent that emotional intelligence is not merely a desirable personality trait in a dentist, but rather a complex interaction of individual aptitude, scientific understanding, and professional experience. When a dentist-patient relationship begins to deteriorate, the manner in which the clinician responds may determine whether the situation de-escalates or progresses into open conflict. A patient may be demanding, repetitive, mistrustful, or unpredictable, but the dentist must nevertheless remain calm, clear, and professionally competent. This is considerably more difficult than it may appear, particularly when such situations recur day after day. One particularly interesting aspect discussed in the book is the association between empathy and a reduced risk of complaints and litigation. In practical terms, the implication is that it may sometimes be preferable to spend considerable time listening to an emotionally demanding patient than to inadvertently provoke a situation in which that patient becomes convinced that they have been mistreated, files a formal complaint, initiates legal proceedings, or publicly attacks the practice through social media. Patients who perceive their dentist as empathetic tend to report greater satisfaction, demonstrate better cooperation, and are less likely to enter into conflict. Effective communication cannot prevent every complaint, but it can eliminate one of the most common sources of dissatisfaction: the perception that the patient has not been listened to, understood, or taken seriously. There is, however, another side to this issue. If a dentist continuously attempts to emotionally rescue every patient, they risk exhausting their own psychological resources. Empathy without boundaries can itself become emotionally draining. For this reason, self-control is equally important. The ability to avoid impulsive reactions, to refrain from entering an argument simply because one has been provoked, and to avoid making decisions under the influence of anger or frustration. Poor conflict management can transform even a relatively minor misunderstanding into a serious problem, damaging professional relationships and affecting the atmosphere within the entire dental practice. Perhaps, therefore, the more important question is not, how do we get rid of difficult patients, but rather, how do we prevent difficult relationships from controlling our working day? Sometimes, the most appropriate response will be to introduce more empathy into our relationships with both patients and colleagues. Sometimes, the solution will be to provide the patient with a clearer explanation of their clinical condition and treatment options. In other situations, it may be necessary to establish firmer boundaries between the personal and professional dimensions of the relationship. And sometimes, the healthiest professional decision may be to accept that not every dentist-patient relationship can be repaired. It may nevertheless be possible to recognize that reality and terminate the professional relationship in a respectful, ethically appropriate, and minimally confrontational manner. The essential point is that the most challenging patients often do not primarily test our knowledge of endodontics, prosthodontics, or oral surgery. Figuratively speaking, they test something different: our character and psychological resilience. They reveal how well we understand ourselves, how effectively we regulate our own reactions, and how capable we are of understanding another person without surrendering our professional boundaries. And it is often precisely these few patients who demonstrate how good we truly are, not only as clinicians, but also as professionals who work with other human beings every single day. And most of us would probably agree that working with people in healthcare can be extraordinarily demanding, would we not?